Is that this celebration in the Rose Garden is quite upbeat here. By a narrow margin, the revised health care plan passed, 217 to 213. President Trump just saying right now, make no mistake, this is a repeal and replacement of Obamacare. And indeed, much of President Obama's signature plan has been vaporized in this House bill, leaving pretty much just that provision that allows children up to the age of 26, this is an extremely popular part of the Affordable Care Act, to remain on their parents' insurance plan. Can we go to New York Congressman Tom Reed? He is live on Capitol Hill. Congressman, are you there?
I am. Glad to be with you.
Okay, sir, you voted for this plan. Now, some people are comparing this, though, at this point, to crowds sort of rushing the football field after a preseason game. You know, the Senate now may very well pull away the party punch bowl. What are you hearing from your Senate compatriots?
Well, you know, obviously we got more steps to take, and the Senate is going to be the next stop in this bus that's going to the finish line in the White House. But I'm confident the Senate will take it up. They're not going to be able to ignore it, and they're going to hopefully improve the bill as it goes forward through the process.
Do you foresee anything that the Senate might change to get it through? Then it comes back to the House to reconcile. Will you basically say, let's just go, let's get it to President Trump's desk?
Well, it depends on what the Senate does, obviously, and you got to read the bill. That's always important, and we look forward to that engagement with the Senate, and I think there's going to be an effort to improve it even further. But bottom line, there's still a lot of work to be done, and there's a lot of people across America today that are filled with anxiety and fear about what we did. We got to make sure we don't lose that voice, too, in this process.
House Majority Whip Steve Scalise just said, and this is a pretty bold statement, Congressman, he said, anyone coming between patients and their doctors ends with this bill. Now, doctors order a lot of tests. Some of them are needed, some of them are not. We hear that from the Cleveland Clinic all the time. Can you promise that, A, that's true, what Steve Scalise said, and B, that this plan in its current form would bend the cost curve of health care, which had been skyrocketing?
Absolutely. We're bringing into the marketplace competitive pressures to drive these costs down. But we still have a lot of work to do on health care, and that's why this is a multi-phase project. And I'm not one to declare victory today. This is just the start of the rest of the hard work that needs to be completed, not only on health insurance and health repeal and replacement, but into health care coming forward in the next few months.
As you know, Congressman, there are some Democrats that are needed. We need to see them vote if this is going to pass. One senator on the Democrat, well, actually he's an independent, but he caucuses with the Democrats, is Senator Bernie Sanders. He just tweeted this. The Republican, quote, health care bill is a disaster. It has nothing to do with health care and everything to do with tax breaks for the wealthy. What would you say to that?
Just obviously party politics, and I would expect that out of a prior presidential candidate. Bottom line is we took on the health insurance, we took on the mandate of Affordable Care Act, Obamacare, and we relieved that today with the first step, or at least getting closer to the finish line of alleviating that. And the bottom line is I hope the senator comes at this with an open mind, with working together to improve the bill for the American people.
House Minority Leader Nancy Pelosi, I understand, is just tweeting this right now, and actually, hold on one second. She said this. Of course, there were staffers seen bringing cases of beer into the Rose Garden. I set that up because you'll see why in a minute. Here's Nancy Pelosi moments ago.
But right now, Republicans are in the Rose Garden having a beer party to celebrate one of the biggest transfers of wealth from working families to the richest people in our country, and that is what they have been about. The trickle-down crowd is now having a beer party in the Rose Garden.
Well, the perception, at least on behalf of the Democrats, is this, quote, transfer of wealth, and they're going to hit that hard, as you know, in the Senate, because they feel that now that big business, and certainly the medical device tax, that goes away too, am I correct?
That's correct. That's okay. In the bill.
And they're going to point to something like that and say, how are we going to pay for this? Even if you put in what everybody says we need, and that is that people should be able to buy insurance across state lines.
Yeah, obviously we're going to hear that argument, but I believe that the tax burden in America is way too high across the board. So this is a step to reduce that. That's why tax reform is the next major issue that we're going to take on, and being on the Committee of Jurisdiction writing that for American people, I look forward to having that debate to alleviate the tax burden on the American hardworking men and women.
And certainly small business leaders are probably excited about the fact that they won't be held to being forced to buy insurance for their employees. But you may want to listen, because right now I want to bring in John Oxford. He's with a small business called Renasant Bank, but he's a small business coach as well. He's standing by. And John, can you give us a sense of what you've heard from the small business leaders that you coach about how onerous or not the Affordable Care Act has been on them?
Well, the 50-person mandate was very impactful to them. But what we've just seen happen is too early to tell the impact of the repeal, as they're calling it, and what will happen in the Senate. So really too early to tell what will happen to our small businesses that we talk to and that we work with. But yes, the cost of it is crushing the small business. And so I think this is a good start today, but we'll have to see where it goes when it gets to the Senate.
John, let me take it one more step, and the congressman is still listening. In your town and in your state, have you seen small businesses go under because they couldn't swallow and digest that mandate?
I don't know that I can speak specifically to a business going under. I do know that there may be certain provisions they have to make in their revenue, and
how about
maybe
laying off
delay in
people?
hiring and expanding.
You know, we heard a lot of people say, I can't afford to cover these people. I'll go to part-time. I'll go to freelance.
Yeah, there is some of that. I think it's the issue I see is expansion and being able to grow their business, because they've got to find new revenue to cover the cost of the health care that they've got to supply via the mandate.
Congressman, what have you heard from small businesses in your state?
I've heard the overwhelming crushing pressure that this has put on their businesses by filling out paperwork, the cost of health care going up, and also the limit on the 50. They were fearful of expanding because they didn't want to go over the mandate level. I've heard business after business say, we're going to stay and not grow because we don't want to be subject to Obamacare.
I want to make something clear to our viewers, because we are fair and balanced here on Countdown to the Closing Bell. We put in no less than 55 calls to different Democratic congressmen. We did not get replies at this moment. Everybody is welcome. We want both sides of this. But did you hear from your Democratic compatriots? I know you guys have some friends across the aisle. And what were they saying?
Well, you know, obviously we try to legislate in a responsible governing way. And having friendships on the other side of the aisle, there is an opportunity, I believe, where we can get some Democratic members to work together on health care as we get out of this partisan repeal of Obamacare environment. So I'm hopeful, I'm optimistic that that's where we will head, because that's what's best for the American people.
John and Congressman.